A sampling at the apiary implies the veterinarian's skill in selecting, taking, packing, and labeling different in-hive material samples taken when suspecting the presence of a particular disease. For example, samples intended for certain types of laboratory research. In doing so, they can sample adult bees, changed honeybee brood, samples of debris from the bottom board of the hive or pest traps, and individual suspicious specimens of mites, beetles, or other pests intended for morphological identification. As well as honey samples from wax combs around brood area for early diagnosis of American foul brood. With each sample intended for laboratory examination, it is necessary to submit a readily completed referral form for the requested examination. For example, the form for submission of materials for laboratory testing after official sampling. In addition to the basic information related to the name and address of the owner and the location of the apiary, it is necessary to enter the registration number of the apiary. The process of official sampling and sending material taken from the hive or apiary to an authorized diagnostic laboratory for honeybee diseases completes the process of setting official suspicion. The diagnosis of the disease is final and is made after the laboratory test has been completed, but with included anamnestic data related to the previous ways of controlling viruses and the existing clinical status of honeybee colony.